Okay, we're live.
Thank you very much. I'd like to welcome you all to the first virtual meeting of the Health and Wellbeing Board, which is due to the current coronavirus restrictions on public gatherings. And we're still keeping going on the online portal, and I think it's been very helpful bringing people together to enable us to save having to travel to all these sit-down meetings. When we come through the debate, I'd ask if you could introduce yourselves to the meeting at that time, probably make it a lot easier. I need to refer you to the published protocols of holding virtual meetings. Could members keep their videos on at all times, but can you put your microphones on mute and less speaking? Reason is just vibrating phones aren't really helpful to hearing what people are saying. In case of a technical problem, the meeting will adjourn until resolved, and if a member loses connection, the meeting will adjourn until reconnected. Or if I do lose connection. If it's just me affected, then the deputy chair would take over, the vice chair would take over. If the technical problems persist and the meeting is incorrect, we will reconvene the meeting at a later date. And can you all we'll go by the clock down on the bottom right hand corner of your little screen, 2 minutes past 10 now. And just to remind you that the meeting will be video recorded and audio recorded and will be available to watch, listen on the website at a later date, and segments of it will no doubt turn up on YouTube at some time in the future. So I'd like to welcome you all to the first actual meeting we've had of the Health and Wellbeing Board for some time. It is a very useful meeting, public facing meeting where the public can also find out about what the Health Service and the Council is doing across the Borough of Harrow. So before we start, just I've received apologies from Councillor Simon Brown, and I think the reserve is Maxine. Councillor Maxine Henson's reserve for Simon Brown today. The first item on the agenda is to appointment of vice chair, and we normally have the chair of the Harrow CCG as the vice chair, but the CCG doesn't exist anymore. But I think I'd like to propose that Genevieve carries on as the vice chair. Is that agreed? I can see people nodding in the session. That's really good.
Agreed.
Thank you. Attendance by reserve members. Members. I said that Councillor Maxine.
Sorry, Graham. Sorry. Can I just say that it might be useful to just minute my actual title?
Sorry, yes.
It is now. Yeah. So I think my title currently is the Harrow Governing Body Member for the North West London CCG.
Excellent, thank you, Genevieve. So, you weren't here when I first started, but I knew you were joining, so I thought.
No, I was here. You just couldn't see me, Graham. Is that possible? Yes, indeed.
We should ask as well if you want to accept the nomination to be the vice chair.
Oh, go on then. Thank you. I'd be honoured.
Excellent. So item 2 is attendance by reserve members, and Maxine is reserving for Simon. Can we have any declarations of interest? They are some are documented and circulated on the online part of the website. If any come to notes during the meeting, if you could let us know, then we can record them at that time. Krishna, are you waving there? Krishna? You're on mute, Krishna. No, we can't hear you, though. You're on mute again. Well, let's send us a message, Krishna, if it's a declaration of interest. Put it through the chat and then we can pick it up from there.
Okay. I'm
going to come to order of the agenda in a moment, but I just want to go through some other points here. So first of all, can we have on the minutes of the last meeting, we held one on the 23rd of March. So are they an accurate record of the meeting? Excellent, thank you. Item 5 is petitions. None have been received in advance. Are there any petitions presented by any members present at the meeting today? No. So moves on to item 6, which is public questions. None have been received. Item 7 is deputations. None have been received. Before we go to item 8, I just wanted to talk about the agenda itself. We do have a large number of very important reports on the agenda today, and so we need to make sure we're concise with our presentations and questioning. But the Better Care Fund report, which is item 10, has been postponed to the next meeting. So it gives us a bit more time. It doesn't mean we should spend too long talking about some of the reports, but we need to give them a good scrutiny and understanding of where we are. Is that agreed to be defer that one to the next meeting? Excellent, thank you. So that now moves on to item 8, which is the COVID-19 and vaccination update for Harrow. Could I invite Carol Furlong and Lisa Henshaw and Genevieve Small to present the report, please?
Good morning. I'm going to share my screen and open up the report. So I'm going to do a quick run through of where we are at the moment on COVID. So the rates have been a bit variable in the last 2 weeks because we've been undertaking surge testing. I'll pick up on that in a moment. We have around about 11 or 12 cases per day as of the 2nd of June. And the interim data from the 2nd of June up until yesterday suggests that the rate's going to decrease in the coming week. Most of our cases are due to the Delta variant, and the remainder due to the Alpha variant. And just a reminder that the Delta variant is more transmissible than the Alpha variant, so remaining vigilant on those cases, making sure we identify the contacts and we isolate people so that we keep the spread as minimal as possible. So this is the dashboard that we usually provide. It shows our rate is 32.6 and our rate in older people is 7.5. As you can see, it's been a bit fluctuating, and our testing rate, which did go up to an all-time high of 1,300 per 100,000, is coming down again now since we stopped doing the surge testing. If we look at it on a ward basis, you can see that it differs every week, and that's largely because most of our cases that happen in households, and we get little spikes based on how many households in that ward have been affected. When we did surge testing, we'd identified that we had an increasing number of cases occurring in secondary school age and college students, and we were concerned that we might have an ongoing outbreak, and along with other North West London boroughs, including Hillingdon, Ealing, Hounslow and Brent, we undertook surge testing. So we asked the schools to take part, and in the week before half term, we managed to visit every school and test both pupils and staff. And we had around 14,000 tests within the schools. We also gave each of the students some tests to take home for their family members, and we had about 13,000 tests returned by family members in that week. We've had more since, but I haven't actually got those numbers at the moment. We're expecting all of those tests to be returned before Wednesday this week. Anybody who was tested positive was obviously asked to isolate immediately, and we informed NHS test and trace about their contacts, and we're confident that we are managing to control any outbreak. We did find some positives, but they were, considering the numbers of people that we tested, it's not surprising that we had some asymptomatic individuals, and our positivity rate for that week was 0.4, and that includes people who had gone to other testing sites because they had symptoms. So our actual rate was very low in terms of the pickup. I still think it was worth doing. Just a quick word on vaccination. We've had 150,000 people in Harrow have had at least one dose, and 105 of them have actually had their second dose as well. But we've got these significant differences within the population, and that we need to address. So we have differences in ethnicity, but we also have differences according to deprivation. Of the people that haven't had their first vaccination, we've still got 2,000 that are in the highest risk group, which is a concern, and we do need to try and get our message across to those people so that we can improve the uptake. It's unsurprisingly, we've got 10,000 in the under 40s who won't have all been invited as yet. So some of the work that we've been looking at is around coverage geographically, and looking at this in age groups. So each of those maps represents a different age group, with the bottom right hand side being the older age group and the top left being the youngest age group. And you can see that there's varying patterns, but generally we've got lower uptake in the Wealdstone Town Centre corridor, down into South Harrow, sort of Roxas, Roxbourne area, and a little bit in the south east of the borough, sort of near Burntoke. And then if we add ethnicity onto that geographical data, you can see that, you know, in different ethnic groups, we have different uptake as well. And this is providing us with lots of information about how we can target the messages in different areas and work with our vaccine community champions in those areas to try and improve uptake. And it's also where we can start looking at things around pop-up clinics and seeing whether or not we can put pop-up clinics in those areas so that we can maximise the numbers of people that are getting vaccinated. We've also been working across North West London on vaccine uptake, and one of the latest things that's happening there is to address some of the concerns of younger women around the safety of the vaccine in pregnancy, or whether it affects fertility. So we've arranged for some experts to be on a panel to talk about that, and that's happening next Monday evening. So anybody who wants to join that, they can click the link, but that information will be on the website as well. And I'll hand over to Lisa to give you a bit more detail about the vaccination.
Thank you, Carol. I'm just going to try and share my screen now. Just give me one moment. Here we go. Okay, can everybody see that?
Yes.
Lovely, thank you. So I was going to give a brief update on the current delivery model for vaccinations, and then touch on uptake rates, just to supplement the overview that Carol's given. So as you know, we have been waiting for a while in Harrow for the introduction of our mass vaccination centre, and I'm pleased to say that the mass vaccination centre will be live and operating from midday today at Byron Hall, and that will allow Harrow residents to be able to book in through the NHS national booking system. So that's really positive, and they are working to a vaccination capacity of 500 people to be vaccinated a day there. It does mean that the primary care, the GP-led side of the vaccination centre at Byron is now closed. Our GPs took that, and I know it was a really hard decision for them to make, but as I know we will hear about later in the agenda, the pressures in general practice are at an all-time high, and there is a lot of patient need. So they are redirecting their resources into primary care and allowing the mass vaccination centre to take over. So in the time that they've been operating, they have vaccinated a significant proportion of our cohorts 1 to 9 and delivered the second vaccinations for that cohort. They have absolutely started vaccinations around cohorts 10 to 12, and the second doses for that group will be handed over to the mass vaccination site. So this weekend was the last weekend that Byron was operating, and it was a big weekend in Harrow. Oh, goodness, for vaccinations. We ran 2 pop-up clinics in one at Roxbourne Medical Centre and one at Belmont Health Centre. People may have seen some of the press coverage of that. They were extremely popular, and I think what was really heartening about it, yes, a lot of the press coverage focused on the younger age groups, but we're doing a full analysis of the demographics of people who accessed vaccinations at that centre. And what we found, there was a lot of people bringing parents and grandparents with them who hadn't been vaccinated yet. And a lot of non-English speakers attended the centre, finding this actually the simplicity of a walk-in model with eligibility purely being based on age made that much more accessible for people. So I think that's a model we can definitely build on. We will need to run future pop-ups through the mass vaccination site arrangements, and we're just working through how that will operate going forward. And the final thing to say on the delivery model is that we are seeking to secure additional pharmacy provision in Harrow. We have 2 pharmacies at the moment operating in the Rayners Lane area. We are advocating for additional resources in Kenton, Harrow East and in the town centre to support the other modes of operation that we have. And I'm aware that they have gone through to NHS England, and we will await the outcome of that. So this data is slightly out of date, and I think following what's been a week of significant vaccination activity, we will see these numbers increase, but this is taken from our GP systems on the 27th of May and shows our percentage uptake rates. I think particularly important to note is the real improvements we've had in our clinically extremely vulnerable cohort coming through, as well as our at-risk cohort. We were definitely working with lower numbers than that just a few weeks ago, so I think that's a real reflection of the concerted effort that's happened around those age groups. And of course, whilst younger age groups were accessing our pop-ups, we haven't yet, well, until today is opened to the 25 to 29 cohort, and as a result of that, I think we will see those percentages going up quite soon. Just a graph that shows how the vaccination activity is operating across North West London and how Harrow compares to that. I think the key message here is that Harrow retains a really strong vaccination programme. We're currently we're working through on every cohort. We are second in North West London in terms of our uptake rates. And finally, people will be aware there is a significant focus on second dose uptake because of the evidence that's coming through around the extra efficacy having that second dose has against the Delta variant. So we've been really focusing activity on there. Our rates of getting those second doses through are good. There's a slight concern with one of the pharmacies around their overdue rate that we are following up on. But otherwise, our centres have done a fantastic job of they're not just inviting people for their second via text. There's been numerous telephone calls, referrals back to people's registered GPs, encouraging people to come forward to them, and also making sure we are going back out to our care homes and our housebound patients to deliver those second dose and bringing that forward to the 8-week interval. So I think that that's been good news as well. So I will just stop sharing my screen there.
And thank you, Carol and Lisa. Genevieve, did you want to add anything at this stage?
No, I'm happy to help with any questions, but no, I've got nothing else to add.
Well, I'll start off with a thank you, I think, because it has been a lot of work that has gone into delivering a lot of the vaccinations across Harrow, across London. And as Lisa said, you know, the vaccination site at Byron Hall has probably been ready since early January. And it's good to actually see it turning into a mass vaccination centre from this week. So hopefully that's going to go well and pick up the people who probably been put off by having to travel to somewhere else and, you know, in the locality. And I think the pop-up clinics you've done over the weekend were exceptionally well received. You know, there was very long queues there, which shows the demand is there to have vaccinations in the locality. And people were actually queuing at the Roxbourne Medical Centre on Sunday as well, because they misread it. They thought it was Saturday and Sunday at both sites. So it shows the demand is there and we need to investigate further. Is there, if you could pass our thanks on to the teams, I think that'd be really good as well. Is there any questions around the vaccinations and the COVID rates in Harrow? Janet? You're on mute, Janet. Oh, you're off, on, off.
Perfect. On, off, on, off. Right, I'm there. Right, I'm Councillor Janet Mokes, the Shadow Portfolio Holder for Children, Families and Schools. And thank you, Chairman. I just wanted to say how absolutely delighted I was that you managed to visit every school, 14,000 tests. That must have been a huge task, and that was really brilliant. So to everybody that was involved, fantastic. I was very interested about Byron Hall having 500 a day. That was amazing as well. And saying what the chairman said about the pop-up clinics, absolutely super. And I'm so pleased those pop-up clinics are managing to attract all those family members, and particularly the people who don't speak English, are unsure, and that's only going to make us all so much safer. So I think that's really good, and that's a very good port of call for people to go. So once again, I'd like to say, Chairman said as well, a big thanks to everybody. Amazing work, amazing.
Yeah, thanks, Janet. I have to say that we couldn't have done it without the full cooperation of the schools. So I think that, you know, the schools have a huge part to play, and you know, everybody was fantastic. I think it is one of the biggest third tests that have been done. And other boroughs are looking at us and wondering why they can't manage to do that. Because what we managed to do in a week, others are trying to manage to do in 4 weeks. So it is quite impressive. Yeah.
Yes, thank you. Christine.
Thank you, Chair. Well, I mean, Janet is often echoing me, so I'm echoing Janet this time. Yes, I mean, thank you, fantastic, phenomenal. And I know that you're right in that other people are just scratching their heads and wondering how you did it. But also just to back up the next point that you made, Carol, which is what a turnaround it was for the schools. And it was wonderful that you joined us for 2 information sessions with the head teachers and the leaders of all Harrow secondary schools, and given what they had to do, that they were facing the equivalent of GCSE tests and actually having to have pupils come in, and it was all such short notice, but they and you were amazing. So, you know, huge thanks. Thank you.
Thank you, Christine. And Maxine.
Yeah, I would just also like to add my thanks to Carol, Lisa and Genevieve for their hard work during this last year. I mean, you've made such a difference to our residents, and the mass vaccinations, I just don't know how you did it, but well done.
Thank you. I mean, this has absolutely been, I think it's a wonderful way to bring our partnership together as well. It's been a real collaborative effort across the local authority, helping us with venues, with the traffic control, promotion to residents. St John's Ambulance were with us over the weekend, who were just amazing, as well as the Royal Volunteer Service. So I think when we can all pull together towards a common objective, it really shows what we can achieve.
Thank you, Lisa. And Krishna, did you?
Yeah. I just wanted to thank Carol and Lisa. It's a great effort, and it's a committed one. That's why the other boroughs couldn't even compete with us, because it is a teamwork. We showed, collaboratively done so well. So thanks to all the team works that you managed to combine. Well done.
Thank you, Krishna. And Genevieve.
Yes, so I just wanted to say that, so I do agree it's been a phenomenal achievement. I think that COVID, there are very few things to celebrate during this period, and it is lovely to be able to talk about something that's really positive, that is definitely making a difference. And we're seeing the reduction in hospitalisations, and we know how hard Harrow was hit in the first two waves, and so it's a really tangible demonstration of the benefit that vaccination is bringing. But I think that we actually mostly owe a debt of thanks to the people of Harrow, because they have really come forward and taken the responsibility to get vaccinated very seriously. And we are seeing, of course, pockets of hesitancy and people wanting to ask questions, which is completely understandable. But in the main, people have felt able to trust the large number of people in this community that want to protect them. And I think that that's been really, really important. And I think that what we should continue to remain is incredibly vigilant and able to, as a community, talk openly to those people who perhaps still have questions, and for them to recognise that this vaccine offer is an evergreen offer. So even if they have, they should never feel like they've missed out on an opportunity. If they then get to a point where they feel they've had their questions answered, they can still come and get their vaccine. And with that kind of open approach, I'm really hopeful that we'll continue to be able to keep our high numbers of vaccination up.
Thank you. Is anyone else? I can't see any other hands on coming up. Can I just finish off with an observation? I think if we look back to the Health and Wellbeing Board pre-COVID times, we were talking about pressure on services, the challenges we faced. And so it's fair to say that we entered into this sort of pandemic with services under quite significant pressure. But it's the way the partnership came together to support each other, I think, is what people are reflecting on, of how we got through the way we have. It hasn't been easy. I think in every speech I make, I say it's been relentless, and it's still ongoing. We're still, was it 6 months of lockdown since December the 21st last year, and it's taken its toll. But when you look around at the way people are coming up with innovative ideas to move the vaccination forwards. Genevieve and Lisa spoke about pressure still within the NHS are trying to deal with the backlog of patients that are coming through, the restrictions of how, there's quite a high demand still on services. So we've done exceptionally well. I think we've built a very strong base to go forward, and we can see that with some of the reports we've got on the agenda today. And we should leave it on a positive, that I think we've learned so much over the last year of how we can go forward over the next few years. And I think that's been brought forward to the reports as well. So if you could pass our thanks back through the teams. We know it hasn't finished yet. We know we've got to start with the next vaccination rollout later this year, but I think we're better equipped for it. So thank you very much. So the recommendations on the report is, do we note the report? So is that all noted? Thank you. We now move on to item 9, which is the development of the Harrow Integrated Care Partnership. That's a long word, this one. So we just call it the ICP for short, I think is its terminology. So could I invite Simon Morioka and Ayo Adikayo, I think that's the name right, sorry, to present the report, please.
Thank you very much, Chair. So I was fortunate enough to be here earlier in the year, I think, talking about some of the NHS reforms, and today we're just giving a very brief update on how some of that applies and is being taken forward within Harrow. My name is Simon Morioka. I'm a former local authority director. I've worked in the NHS, and I currently work for a social enterprise that's been supporting some of the work in Harrow. And as you say, I'm here with Ayo, who is the head of the ICP. I'm going to share some slides, but I will walk through these fairly briefly just to give as much time as possible for questions and responses at the end. And I think it's worth starting by saying just that there's obviously a very long history of integration within North West London and within Harrow. And that is something that's very much a national as well as a local priority now. And obviously the Integrated Care Partnership, or the ICP for short, is the borough-based partnership that is responsible for bringing together NHS, local authority and voluntary and community sector around the improvement of health and wellbeing for the local population. But sadly, as we know, both in North West London and elsewhere in the country, despite the many years of work in this space, too many people still experience disintegrated care, particularly those living with one or more long-term conditions, but it's something that affects the whole population. I'm not going to try and talk through the entire history of that development of integration and the ICP, but I would like to focus on just the last 18 months and what that means in terms of the ongoing development work that's in progress now, why Harrow is increasingly being seen as a leader in this space, but also some of the challenges which remain in terms of the future development of integrated care. So I think one of the questions which comes up a lot is, what is the ICP? And again, in Harrow as elsewhere, I think there is a recognition that for many people living in the community, but also for many people working in the health and care services, they might not even know what the ICP was or that it existed. And I think there's an interesting question about to what extent that is an issue. So like many of us, for most of my life, I've relied on the fact that I could go and switch on a light bulb and the electricity would flow. And I know nothing really about the network of organisations that are involved in the generation of that electricity, the supply and transmission, the regulation, etc. I just rely on it working. And it would be great if we could just rely on all of our health and care services coming together and being coordinated, when we need them. The challenge is obviously that delivering health and well-being is a much more complicated business than delivering electricity. And what we're talking about here is a lot of different sovereign organisations within Harrow as elsewhere that all have their own separate leadership management. They all have their own separate performance targets and regulatory responsibilities. But also, as I think was picked up in the last item, an increasing recognition that actually the health and well-being needs a coordinated person and community centred set of services and professionals to enable it. But a lot of the outcome actually involves the individual, their family, their carers. They are the ones who are there 365 days of the year. So it's not something that can be produced just by public sector or even public and voluntary community sector organisations working together. So in a sense, the ICP is on one level about creating the frameworks and the structures and the ability for all of the different people involved in creating better health outcomes to come together across the spectrum of planning services, designing services, delivering services, and also evaluating, understanding where improvement is needed. And more than just structures and processes, it's about creating a culture within Harrow where people feel confident that they can share information, that they can work together on a common set of goals, and that they can bring together their assets and their resources in a way that delivers for everybody within the borough. And this slide that you'll see on the screen at the moment is a product of work within Harrow to really understand what are those key things that need to be in place and signed up to across the organisations, but also working with individuals and communities in order to enable people to work better. All of that means nothing if it doesn't then lead to some direct improvements in the experience and outcomes of care. And a number of priorities have been identified within Harrow as to where that improvement is needed most. And I would say this list is not in any particular order, and probably the one that kind of stretches across all of these areas is that key one around tackling inequalities. But I think also it's worth noticing that there is a mix of different responsibilities and organisations involved in each of these. And in a sense, this is building on the experience of working together through the pandemic, but also complicated by the fact that that singular purpose that brought people together and continues to bring people together based on a huge public health emergency that affected everybody, required everybody to work differently to respond. That same sense of shared purpose, shared activity and shared resourcing needs to now come together across each of these very diverse sets of objectives, spanning from supporting children and young people through to care homes and those are coming towards the end of their lives. In each of these areas, it needs that same commonality of purpose, of understanding and of joint working. And that's one of the reasons why this is such a challenging thing for any ICP to do, and such an ambitious set of targets and objectives for Harrow. Quite recently, the Harrow Health and Care Executive, which was formed just before the pandemic and has been instrumental in coordinating and managing the pandemic response, including bringing together colleagues around the vaccination programme, had a 1 year on reflection. And we thought it was worth sharing this because it highlights, I think, some of the key lessons learned, but some of the key areas for development moving forward as well. And just briefly, they could be broadly grouped under these 5. So there was an overall sense of real progress and a real sense of people operating differently over the last 12 to 18 months, but also recognition of the extreme pressure on primary care and the need to understand how to bring together and support GPs within Harrow, not just through the pandemic and the recovery of the pandemic, but also recognising the criticality of primary care to being able to deliver better coordinated care into the longer term. There are still a whole number of unknowns around the national direction on integrated care systems and what impact that will have on borough-based integrated care partnerships. But there is an opportunity over the next few months to help shape that through the way in which the ICP in Harrow is developing. There are obviously ongoing challenges around resourcing, and if you like, these form part of the really complex issues that the ICP is increasingly now having to focus on in order to think about how it can deliver not just the kind of immediate needs for the community, but the longer term sustainable approaches that are needed to supporting people throughout their lifetimes. And also there was a whole set of conversations around future priorities, of which, as I say, very central for that was addressing both existing health inequalities, but those that have arisen as a result of the pandemic. This is just one of the sets of findings from that review, but this is unusual and this is different from other ICPs that I've been involved in the sense of the strength of feeling within those working on the ICP, and this covered everybody from community services, mental health, to primary care, the acute hospital, adults and children, social service, public health, and the voluntary and community sector. That the ICP really is becoming a very effective way of working together, of building trust, of building equality, and of starting to understand a lot better how what each individual is doing within the overall health and care system in Harrow can contribute to something that's more than the sum of the parts. And I thought it was worth just highlighting this last statement about aspirations for the Health and Care Executive as a key part of the Integrated Care Partnership. which is to be the voice of the Harrow population within the ICS and to give Harrow citizens the best caring services they deserve by bringing in the resources to address inequity and comorbidities. What that means in practice in terms of next steps, this is very much an evolving process. So there have been some changes to these even since these slides were produced just a few weeks ago. But a series of conversations over the next coming weeks, of which this update is a part. And starting, I think, most critically with that question of how does the ICP put citizens and patients at the heart of everything it does? Again, this is something that is an aspiration of all borough-based partnerships, but not necessarily something where there is a clear model upon which Harrow can build. And as such, there have been a number of conversations within the local authority and within the partnership as a whole as to how best to do this. And I think within the last week, invitations have gone out to a number of community groups and representatives, in addition to the patient networks and participation groups that exist, looking to bring together as broad possible set of representative views from within the communities being served around how that purpose of the ICP, that core purpose, is embedded in everything that the ICP is doing. I think it's worth saying that this is going to be facilitated by the leaders of the various different health, care and voluntary community sector organisations involved in the ICP themselves. So the intention is not just to have a one-off conversation, and certainly not to repeat the previous really helpful conversations that have been had already within Harrow about how people perceive and what their priorities are for the health and care services, but to create an ongoing dialogue and an ongoing commitment from the individual executives working within the different organisations with groups of within the community, recognising that this is about now delivery. So I think a lot of work has been done on what a vision for better care would look like in Harrow and elsewhere. This is very much about moving beyond the what to the how that could be taken forward in practice. And you'll see just at the end of the pack, there's a couple of slides that just give a little bit more detail on what's happening in each of those key priority areas to date and what's happening next in terms of their development. I will just stop sharing there if I can, and just would be very happy with Io to take any questions arising from the presentation.
Thank you, Simon. We had the presentation about the ICS at the last meeting, and it's right that we have the one for the ICP at this meeting to explain all the work that has been taking place and how effective it has been as well, which you've highlighted within the presentation, some aspects of it, the out of hospital plan, and that's worked through the ICP and it's worked very effectively. Is there any questions or comments on this report? John.
Thank you, Chair. I'm John Higgins. I represent the voluntary sector on the Health and Wellbeing Board. And I suppose just a couple of questions, really. I mean, I know that it's a changing picture, but are you able to sort of make clearer what the relationship between the ICS and the ICP is? Because clearly the ICP is Harrow based, and I know the ICSs will be a statutory organisation, and some of that is being top-down led from central government. But obviously, for local organisations, local people, the issue is where does the Harrow voice feature, and how does it hold decision making to accountability? I suppose really, since your light bulb example is interesting, but clearly in terms of local health services, there's an issue about accountability around decision making. And I suppose the other question was just a bit more specific, is that I presume that list that you drew up of organisations is only an example, since there would be many other organisations that would need to be contacted, and I don't know whether there's a way of checking that that's that all are included. I mean, I noticed that there were, not all mosques were represented on that list, that the voluntary sector community forum wasn't represented on it, and etc. etc. So it would be good to know how we can ensure that that list is as comprehensive as possible. But my earlier question is, how does the Harrow voice feature in all of this as it develops, really?
Did you want to take that one now, Simon, or?
Yes, I'm happy to. Thank you, Chair. And just to say, on the organisational list, it's definitely a non-exclusive list. And one of the things that I know that the ICP is doing through this process. I mean, that list was based on the COVID awareness funding and the networks that have been developed around that. But I know that there's an ongoing exercise to make sure that any other organisations are picked up through this process, and good representation actually from the voluntary and community sector at the moment on the ICP Health and Care Executive, which is helping that process. Genevieve may have a view as well on the ICS. It's a really good question and a very difficult one to answer right now, except to say that the white paper from the Department of Health and Social Care makes absolutely clear the primacy of place within our new health and care system. And for all the reasons that you outlined, John, that what we know is that the outcomes will not be delivered at a system level. The outcomes will be delivered at a neighbourhood and community level, and that the closer the decision making is to that level, the more likely it is to produce the kinds of services and the kinds of outcomes that people need. So I think there is an ongoing, and there will always be an ongoing tension between what's done locally and what's done centrally, if you like. But there is a very strong commitment, I think, within London to making sure that the integrated care partnerships that will exist in every borough are empowered to deliver the kind of care that people need. And I think it's by demonstrating the effectiveness of that in Harrow and elsewhere that more and more responsibility and accountability will be brought closer to people within their communities.
Genevieve.
Yes, thank you very much. That was why I put my hand up. Yeah, to try and help. I do think I think Simon has articulated it very well in terms of the fact that we are in a strange position where we are yet to have the statute that will help us be clear exactly where we are in terms of ICSs. But Sean Harris, the Harrow Council Chief Exec, and myself currently sit on the ICS executive for North West London. So we are very aware of that tension that could result if we were not getting the balance right between the ICS and the ICPs. I would say that my feeling with all of the work that's happening at North West London as part of the ICS is that very much the ICPs are an incredibly important building block for how things will work across North West London. North West London is quite complicated. There's quite a lot of different boundaries and providers and providers that work across the landscape of North West London. So I do think that having the ability to see that from a North West London level as well as from a Harrow level actually will afford us the ability to really get the best for the Harrow residents. So I think that when it comes down to accountability, we will have to look to the law to see how that actually gets implemented. But as a statutory organisation, the ICS will have at its heart the responsibility to deliver a health service to all of the population, and at the very core of a lot of the work that the ICS wants to do is around tackling the inequalities that we are sadly aware of, and as a consequence of that, I think that will be a good starting place for us to work hand in hand at a Harrow level and at a North West London level.
Thank you, Genevieve. I was just going to add as well that I'm chair of North West London's ICS as well, and it makes it quite interesting that we have quite a number of people from Harrow sitting at that table as parlance. But the the importance of the ICP cannot be overstated in the sense. It's coordinating the health of how do we respond to health in the locality. And going back to your second question first, John, about the 35, that's the organisations that were supporting through the COVID awareness funding. But I think the invite has gone out, is going out, it's an open invite to all community groups, because they want that engagement to take place to make sure no one's missing out. So at an ICS level, the first priority that has come in is tackling poverty and health inequalities. So that's flowing down through the systems, and it's also within the ICP as well. So it's a two-way conversation that's taking place. The challenge we face, and no one's really sure about it, is what the white paper is going to say around health and adult social care, because they seem to be integrated in some parts and not others. So we're waiting to see what that comes out with, how that operates between. But as Genevieve and Simon have said, Harrow is very far advanced on that, and they're looking at how this is working to extend out into other areas as well. So it is quite an important sort of role. But it's something we are keeping an eye on, because we don't want to lose that local input around local health concerns that are different across different boroughs that the ICS could lose. But I don't think it will, because the people we have that are attending those boards and panels at a senior level. I can answer it more, but I can give you a call, John, and go through some of what that's about. That we have a number of hands come up. We've got Christine, Marie and Janet. So Christine.
Thank you, Chair. I want to say thank you to Simon and to Genevieve for providing as much information as you have. And it is comforting to know how well represented we are as chairs on the ICS exec, etc. But I think you've more or less actually answered my question, but I'm still going to kind of put it forward, which is, it seems to me, and maybe the white paper is the answer to all of this, I'm very old-fashioned. For people who know how chaotic I can be, I actually like trees that join up. And my memory is the terror of what happened when there was a reorganisation of the NHS, and we had all these wispy kind of branches, which actually didn't really go anywhere. And you ended up with this vague lack of accountability. And it's really good that Harrow is Harrow, and it's really good that we've got you lot, because you are very good. But basically, it comes down to not people, but unfortunately to a line on a map or on a piece of paper or in some published government edict. And my concern is that even though the priorities of the ICS and the ICP may be the same, and I think this is what you were thinking about as well, John, if they're not actually properly linked up in some way, where, you know, we need a hinge, don't we? We need an absolutely undisputable hinge where a decision takes place and where one links up with the other. But I think what you've told me is that that's going to be in the, is that going to be in the white paper? It's not that I'm not concerned about social care, Graham, but that becomes an aspect, that becomes a topic. It's more about the basic nuts and bolts of how things fit together. So forgive me if that's very obvious to everybody else, but I just felt that it was important to say it. Thank you.
I think we'll come back at the end on that one, because I think some more questions are going to come in around governance. Marie.
I think that leads very neatly. So it's Marie Pate from Healthwatch Harrow. I think my question is following on from Christine's, but from a different angle. As an organisation who represent the voices of people in Harrow, the bit that I'm struggling with, and I appreciate, I don't think the answer is there, is where are the points where we as an organisation should be escalating what we're hearing. And I think that comes back to the structure and from what everyone's talking about. It's where are the pinch points, where if there is an issue or something good, is your go-to place. And that's the bit I got to admit I haven't fully got my head around yet. I tend to go to Genevieve and Lisa, who are excellent, but I'm sure I go to them sometimes for things I shouldn't. But it's, to me, it's understanding if we're hearing things, what's that route to escalate to get it at the Harrow level, but then also at the North West London level? So that was really just my observation. And my second one was, have the invites gone out yet, Simon? Because I don't remember seeing them, but it could be that I've just missed it in my email. So it was just to check because I wasn't aware of the dates. So it'd be worth just clarity on that at some point. Thank you.
Excellent. And Janet.
Thank you, Chair, and thank you to Simon and Genevieve. I really wanted to stress just a couple of points. First of all, with the individuals and the carers, which are so important with this, and for be able to create better outcomes. Now, support for carers is so important. It takes the load off a lot of organisations within the borough or within North West London, and they need so much support. Now, I know Harrow carers do an awful lot to help, and I think that is so important to stress, because there are an awful lot of people out there that are caring for people, and they need a lot of support. And the second item I wanted to say was about provision for the COVID mental health effects. And I think that's something else that we will need to look at in the future. Thank you.
Thank you, Janet. There's no other hands up. So Simon, did you want to pick up some of those points? Then Genevieve and I could pick up the others, and or Paul could pick up the other points.
Definitely. So just to say, on the slides, it spoke about the first session being this Friday. It was actually, we've actually put that back to next Friday. In terms of bringing in community groups, give people a bit more time to schedule and respond. And Marie, I could check about the invites and make sure that you have those dates if they haven't come through for whatever reason. I think the point about carers is very absolutely critical. Harrow carers are a fundamental part of the health and care executive. And I would, without getting into too much of the debate about the ICSs, which I know is something that is very opaque at the moment. Integrated care is happening at the moment all over London and in Harrow, but too often it's the patient or the carer that is having to do the integration. And I speak from personal experience as well as professional experience here. So the role of the ICP is to remove the barriers and to support the individuals and communities to get the coordinated care they need. And if it does nothing else, it will have succeeded. So I think that that is true and relevant to the relationship with the ICS, that what the Harrow ICP needs to do is the right thing for the people of Harrow, not the right thing for the ICS. But in doing that, it will also deliver better integrated care, which will help Harrow to maintain a leadership role in terms of that more general development across North West London and the country as a whole.
Thank you. Genevieve, did you want to add anything more?
No, I think, I mean, I really do share people's confusion, because I think, and Christine is absolutely right, we need to see the relationships on a page in a way that actually lends that clarity. I'm not sure everything's going to be answered in the Act, but I think that what we will at least know is what has been prescribed, and then we'll be able to then fill in the blanks afterwards. But I think everybody will have a desire to see those structures. I think we have to recognise, though, that the whole thing about the ICS is it is a collaboration, and so we'll never be able to write everything down. But I think the principles, the ethos, and the main objectives that we have together, that's going to be a really key point as well. That you'll never be able to really consolidate into a diagram, but at least once we know what the Act says, we'll be able to actually fill in the blanks.
Thank you. Yes, the points that have been made in contributions is things we've raised through the ICS as well. But I think the important part we mustn't lose track of is the ICP arrangements were put in place in Harrow a few years ago. We formalised it more in 2019 and really pushed it hard just pre-COVID of all things in 2020, but it's held up well. And I think we've adapted and met that challenge head on. And Simon sort of always come back and said, how well we are coordinated and working well together, and uses it as an example in other places. The reason we are being quite hesitant is we don't know what the Act's going to say around the ICS, but we do know what it's going to say around the ICP, around integrated care, which is one of the main reasons we're arguing to keep the Health and Wellbeing Board in situ, even though we might review it after the white paper comes out to see if we need to add anyone in. We won't be taking anyone off, is what we've been saying. It might be easier to bring people in. And an example is the Harrow CCG is technically not in place, but Genevieve's comes through as a representative from Harrow's sort of part of the CCG, you can see what I mean. So titles may change, but we know we're bringing together people who can make that difference. And right from the beginning, when we moved this back in 2019, the reason we've done it is around resident focus. I think Simon said the person hasn't got to move around to try and get that coordinated care. We're bringing it into one place, and that's what's held up and working so well. We just got to make sure those avenues are checked, checks and balances are in place. One is the Health and Wellbeing Board, we've got Health Watch, we've got Health Scrutiny, and there's a few other patient groups that are around that can bring that challenge in to make sure other people are not left out. Anyway, I realised I'm not chairing this meeting as well as I should do, because I'll be told off later, because we've got an hour left and we've got 3 big reports to go. So if there's no more questions on this report, can we note the report as it is at the moment, with the points that have been made? I think we need to feedback once the white paper's published, and we can bring that to a Health and Wellbeing Board as well before we respond. So item 10, as we say, has been deferred to the next meeting. Item 11 is the annual public health report, which is from Carol.
Hi, guys. Yeah, I'm just going to share my screen. Here we go. It's been a tough year, hasn't it? And last year we were completely consumed with all things COVID, and we did an update report on the impact of COVID, but it wasn't really a proper annual report. Felt it was really important that we tried to get back into this cycle of looking at annual report. So we've done one, and it's picking up on the fact that during COVID, lots of people have become more aware of their surroundings and the opportunities for interacting with nature and getting outside, taking exercise, and this is what we want to try and promote, that things continue. So we've tried to showcase and look at the benefits of green space. So just a reminder that an annual public health report is an independent report from the DPA, which reflects the health and wellbeing needs of the local population. It can have a different focus every year, and that's the way I prefer it. And it raises key issues about health in the borough. What we've tried to do this year is look at the green spaces and how we can maximise those opportunities to promote healthier lifestyles, and try and challenge people to get out there and enjoy how beautiful Harrow is. So why did we pick green space? So as well as people actually getting out there and doing more, it's really important that that we look at how people use green space in the borough. We have, as with everywhere else, we have an obesity problem. Nearly 55% of adults are overweight or obese, and nearly 17% of pregnant women are obese when they first book in their pregnancy. We've got 20% of children in reception being overweight, and that rises up to nearly 37% of children by year 6. But on the flip side of that, less people do enough physical activity. and children don't play outside as much as they used to. Adults walking to work is relatively low, and cycling to work is even lower. And our mental health has been drastically affected by COVID, both for adults and for children. So if we look at how the green spaces in the borough can actually benefit, obviously it provides opportunities for increased physical activity. There's loads of evidence about getting out there and enjoying either physical activity in itself, or just actually being outside and enjoying the spaces that we've got, to lower the feelings of stress and anxiety that people have. It also provides those opportunities for social cohesion and interaction. While everybody's been in lockdown, it's been quite nice to go outside, and even if you're distant, to see other people. Nothing worse than just being locked in your house and not seeing anybody. So it has provided some of those opportunities. The other thing is things like the parks and the friends groups actually provide a really important glue that brings the community together, and from all different stratas of society. And it's just sort of back onto the mental health aspect. It improves the way that we think, reduces mental fatigue and that irritability, by just actually taking time to be more grounded and just help yourself feeling a bit better about being outside. Also improves our vitamin D levels, obviously, because we're out in the sunshine, and our physical activity and fitness levels. So we look across the borough, we've got lots of different green spaces, whether they are officially parks or allotments, or like things like the green gyms in parks, and that doesn't always click with the amount of deprivation that we've got in the area. So if you look at the central part of the borough, where we've got some fairly well deprived areas, we haven't really got that much green space. And I think it's really important that when we're looking at redeveloping sites, that we have an eye on green space, as well as maximising, the amount of housing that we're building, and that we think about planning things in with opportunities for walking and for exercise and for just enjoying being out in nature. So what we want to do is have that conversation with residents about how we can use green spaces more, how they can improve our happiness and our healthiness, that we work with our colleagues in planning, looking at health impact assessments, so that we prevent green space being unjustifiably lost and increase the provision of green space that we've got within any new developments. That we look at green space as an opportunity to tackle inequalities. I mean, we've talked about health inequalities in general, and health inequalities specifically, as being part of the Harrow plan, and that's really, green space can actually improve that. Again, about protecting the spaces that we've got, and improving the accessibility to those spaces, making people aware. So one of the things that we'd like to see is, you drive down the road sometimes and see a fast food sign saying, you're only 1 minute away from whatever. What about if we had signs in the borough that said you're only 1 minute away from your local outdoor gym, or 1 minute away from going to feed the ducks? You know, those sorts of things would, you know, maybe nudge people in that direction. And of course, you know, promoting everybody to use the green spaces and making people aware of that in terms of mental health and well-being. And for residents, you know, we challenge people to find out where your green spaces are, how you might get there, how you might change your journey into work to maybe incorporate walking through the park or walking through your nearest green space. Finding out what other people are doing in your area and connecting with friends and making new friends. Having those opportunities to unwind from the stresses of the day. I mean, getting up really early and listening to the dawn chorus is fantastic. And you know, just trying to get out there and build that into normal weekly routine and make time. Time is always something that we're really pressing to maximise the amount of time that we've got. What we actually need to do is think about more about our time as being a precious resource that we shouldn't be squandering, and maybe instead of sitting and watching the telly, then you know, maybe take 10 minutes out and go for a walk in the community. So the report will go onto the council's website. It's nice, it's bright, it's colourful, it's got lots of information in there, tells you where lots of the areas are and what some of the facilities are. And yeah, I hope people enjoy reading it. I'm happy to answer any questions.
Excellent, thank you, Carol. I was trying to demute myself and failed miserably. It's a very positive report. Janet, you have your hand up.
Yes, thank you very much, Chairman. Yes, Carol, absolutely super report, and it's absolutely amazing for the well-being of the person, and I think that is the most wonderful idea. And as for the signage, I think that is fantastic, and I think we ought to take a note of what Hillingdon have done with their grass verges and put some wildflowers in there, because that really boosts you. If you go down anywhere in Hillingdon, you see these grass verges with these amazing wildflowers. It has such a lifting, a get well feeling. It's incredible. Yeah. It's amazing.
Yeah, and I completely agree with that, Janet. They're really beautiful, and I've done my own little bit of greening. So everybody in my team and everybody in my family, for Christmas last year, I bought them bee bombs.
Oh, I know.
So that they could create their own little bit of wildflower meadows.
Yes.
So I'm all for that. I think that's a great idea. And you know, in terms of saving money for the council on cutting grass, we'll make the economic argument as well.
I mean, even if you have,
that's a great idea.
Yeah, it's a great idea, Graham. Even if you have little areas in green spaces, you know, to have the wildflowers and whatever, you don't have to have it everywhere. But it would help, and also with building new housing as well, to have that sort of thing for the get well feeling. And I mean, it really lifts your spirits, and you know, it's incredible. But I think the signage is an amazing thing to do, because a lot of people are unaware what is on their doorstep. And if they can, you know, they're out of their cars, they're on the pavement, and they just need to look and see and go. So well done, Carol. It's a lovely report. Thank you very much.
Thank you. We have Maxine, Christine and Krishna. Maxine?
Yeah, I just wanted to echo really what Janet said about how well thought out your report is, and the ideas are really good. And I would also like the chair to know your report, because he used to get out a bit more and do a bit more walking. Got it, Graham?
I walked down to get my coffee. Christine.
Thank you, Chair. This is a little thing. First of all, I need to apologise for the fact that I just launched into talking the last 2 times and didn't say who I was, which was unintentional. So I'm Christine Robson, and I've got the portfolio for children, young people and education. And this is not about any of that. It's just a little bit of feedback over the years. I've got vetches and things which are growing in my nice wildflowers, growing in the bit of grass outside my front door. And yesterday I had put up a very amateur notice saying, please don't mow because, and you know, they were really nice about it. And I'm just contrasting this with what it was like years ago when I planted daffodils and they just mowed them down. And yeah, and you know, so I think it's worth doing this. You don't need to go and get, you know, because Hillingdon's got loads of money. You don't need to go and get a packet of wildflower seeds. You can just keep the buttercups that you've got. And my experience is at the moment, the council is being thoughtful about whether they mow it or not. Thank you.
Thank you. We've got 2 more people, Krishna and then John.
Can you hear me?
Yes, yes.
Okay, good. Carol, it's a great project. You know, Harrow is already known for, it's a great place to live, work and visit. And this kind of, you know, you are now encouraging people to, you know, making use of the green space area and have the signage also, which is going to make a big difference. And also, I think not only our people from Harrow will benefit from this, and we're going to invite visitors too. You know, we can make a nice brochure saying that these are the special features in those different area within the borough itself. You know, where you can come and have a healthy life and explore the difference and so forth. So it's a great idea, and I really admire. Thank you.
Thank you, Krishna. And John.
Thank you, Chair. And yeah, I agree with everything else that's been said. I think, Carol, it's a very innovative idea to focus on something like outside spaces, and we do know that over the last year that, you know, for a lot of people it's been a bit of a godsend. And then just to note that there is a very good relationship between the voluntary parks groups and the council through the Parks Forum. But on a personal note, I use my local park a lot, and if you have a good day, weather-wise, the following day it's a mess of rubbish, and the rubbish is collected by volunteers in the main, and so anything we can, I think, in terms of the getting more people out and using the parks is a brilliant aspiration, but anything we can do to build on that work that's done with the local parks groups to support them on the practical side of the impact of people using those open spaces, I think would be greatly appreciated, because it does largely rely on volunteers, and if more people are using those spaces, which is great, we need to think about how that volunteer army can be supported, really.
Yeah, I completely agree with you, John. I think the Harrow Park user groups are brilliant. I love going to their meetings because it's full of people who are, you know, they're very can-do people, are very community-minded. So yeah, we're really happy to work with the groups, and I would see them as being one of my key allies in deciding where the signage needs to go and what they want to highlight in their local park.
Excellent. I can't see any more hands up. I do agree with all the points that are being made. I think if you go back a few years when we tried letting the grass grow longer, we got thousands of complaints coming in. We got more complaints than support. The difference was, I think the park user groups have helped when we set them up in 2015 in the forum, and coordinating the volunteers around the parks has shown which parks can be wild growing and others that are sort of manicured to to a bowling green standard. But it's even things like on the grass verges that the teams do leave planted areas, but we do get a lot of complaints about, oh, you haven't cut the grass to get an approach. And I think it is an education sort of part has got to join in about what nature is really about and the benefit it brings. And that's the flavour all the way through Carol's report. So it's really good. So the recommendation on the report is to be note the report or agree to report. Let's agree it, because that way we can say we're going to bring the the environment into health. Excellent, thank you very much. We now move on to item number 12. What was time? Oh, 20 past. So we've got the public health quarterly update, and that is invite Carol to present the reports.
Yeah, actually, I'm going to let Lawrence present the report. I think it's really important that we talk about how we've changed during COVID and how we're trying to get back on track with, you know, as we talked about the NHS services getting back on track, we're actually looking at the public health stuff as well. Lawrence, I hope that you're there.
Yes, Carol, I'm here. Thank you very much.
Yeah.
I'm just trying to.
Do you want me to share my screen and you can tell me when to move the slides on?
No, I practiced this so carefully. No, I can't find it. Excuse me, just a moment. I'm really sorry about this.
Lawrence, I put the slides up. So if you want to.
No, it should be opening now, Carol. I'm hoping that you can all see this. Apologies for that.
Dead air, Lawrence.
Excellent. Thank you very much. So yes, I presented this as the quarter 4 report. It's more a cumulative report actually, because it does cover the period of the last 14 months or so. So in the first section of the report, all I've really given is some context to COVID, and in the second, as Carol mentioned, I've demonstrated how the services have changed in response to COVID, and then I conclude with a slide which sort of sets out where we are now and our efforts to tackle inequalities. So the first slide here is the context information. I want to be fairly brief here. As at the 27th of May, we were up to 21,100 diagnoses. We had an infection rate higher than London, 8,400 compared to 8,100 in London. The figure that's key to this slide is the next one, is excess deaths. So this is literally the difference between the number that we would ordinarily expect to die and the number that have died, and that has been modelled. It's been calculated as 598 towards 600 excess deaths. The other point very quickly, of course, is over the last 14 months, we've seen the introduction of PCR testing, on mass scale, lateral flow testing. These are all distant concepts from when we first approached 2020. And there's some figures there about vaccinations. We're obviously concerned with vaccine hesitancy, and we're currently monitoring variants of concern and their behaviours. So I mentioned the excess death of 598. This is important because we know that this unduly affects different cohorts of the population, being male, living in deprived areas, being from Black, Asian, minority ethnic background, are found to be associated with worse outcomes. And of course, with 64% of our population in such groups, it makes us particularly prone. And again, using the modelled figures, the excess deaths has been translated into 19 percent higher in the white population than you'd expect, 76% higher in the black population, and 73% higher in the Asian population. So that's really the inequality point. So I'm going to leave COVID there and move on. This is a description of what we've been doing over the last 14 months as a department. I have to take particular credit here to Bridget, who's really been fundamental to this work. We've been interpreting the guidance as it's changed, sometimes on a daily basis, and we've been working very closely with schools, which has been new to me, and it's something that I've thoroughly enjoyed and want to continue and develop. We worked with other departments in the provision of PPE. This is particularly Bridget, facilitated things like mask fitting, and we've become the lead contractor PPE orders for the West London Alliance, and more recently the London PPE Commissioning Alliance. We've continued to promote healthy lifestyles, and the other thing that I did want to just mention here is the Thank You Schools campaign. So this was something that we launched, so there were key representatives from the healthcare community thanking schools for their work. We worked with Mind in Harrow and Young Harrow Foundation, and we arranged various sessions for teachers and school staff to benefit from. So that's what we've been doing. That's been largely the day job over the last 12 months, 14 months or so. In public health, across the top there, and I've mentioned 5 main commissions, and then all I've tried to do down the left-hand side is illustrate sort of where we were in the different phases of the pandemic. So starting from February 2020, about September 2020, and in April 2021. Someone else is now in control of the presentation. Excellent. Hang on, no. Couldn't I just take control back? Because yeah. Okay. So let me just start very quickly with substance misuse. Back at the beginning of the pandemic, BCP is the business continuity plan that was implemented very quickly, and then it swiftly moved through to the position in September where we were operating a virtual service, face-to-face offer for emergencies, and there was also the expansion of collection of prescribed medication from pharmacies. That's September, and where we were in April is the service continues in a virtual format except for the emergency face-to-face programs, and we're in so that over this period, the number of people that have been in treatment, tier 2, tier 3 treatment, has increased from 572, sort of baseline period 1920, up to sort of 605. So I'm rather keen to see if that continues. But of course, what has been missing is the outreach work, and so I don't know, and what we're waiting for will be to see if that outreach rate will actually generate more clients seeking treatment in due course. In terms of sexual health, I think the big change here was obviously the business continuity plan again was implemented similar to substance misuse. It was a focus on the emergency response and harm minimisation, face-to-face contacts where there was a clinical need, but there was a growth in the Sexual London e-service. Now, in numerical terms, that's been an increase from 7,700 in 2019-20 up to just under 11,000 in 2021. So I think this is something that will certainly be looked at and possibly continued, as it seems to be a popular way of providing this service. The only issue that I'll probably flag at this point is that there was a contraception pressure at the end of last financial year, beginning this one, regarding contraception and LARC provision in primary care. So we've been working together to provide a solution for that. But in contractual terms, the sexual health services is a block contract, and we don't have any financial concerns over that in this year. In terms of health visiting, all contact was virtual except the new birth visit. Initially, the health visitors and school nurses, about 30% of them were redeployed, and the key focus was on safeguarding then. And then over the course of the beginning of the pandemic, we saw the 6 to 8 week review visits drop to sort of 50%, but that's now increased back, so they are recovering swiftly. The issue that we're left with school nursing is amblyopia, and this is the eye screening, commonly called the lazy eye, and we are in a position where we think we'll have caught up that screening program by the end of this summer term, so that's good news. So we're in a position now where the health visiting service will undeniably go through a reorganisation or transformation program, and the school nursing in particular, we're looking forward to continuing to work with them and integrate our weight management offers there. And the last point there is that the How Are You survey results was launched just before half term, and we have some early results back from that. Some 6,500 children told us how they're feeling, and so we're very keen to take those results and do something practical with them. In terms of NHS health checks, that was obviously initially paused, and then it was offered to those people that already had a blood test. So this, in numerical terms, the number of people that have actually had a health check is sort of half last year and what it was the year before. And then where we are now is that we're sort of regrouping with health checks, and again, we're trying to link anybody that's gone through with a health check into other services such as social prescribing. The last one there is the weight management stroke shape up program with Watford Football Club. There was a very momentary pause, and they were probably the quickest to change to an online offer. And we had 126 people through that program, which doesn't sound like a huge amount, but it was a new service, and we're proud of that number, and we're obviously looking to expand on that with the additional monies that we received, and we're deploying, expanding the program at Watford, and I'm particularly keen to ensure that that program is culturally appropriate, and it targets some of those inequality areas that we mentioned before. So there'll be a review and a restart of that program in September, or a continuation of that program in September. And the other thing I've mentioned there is that we've done a series of training programs with various groups of staff, including social care staff, and this is about having the tricky conversation, how to talk about weight. So moving swiftly on, these are some of the programs that we're relaunching, or they are new programs entirely. So you may have heard about the expert patient program. So these are patients that are, this is acknowledging that patients are experts and helping them manage their conditions in the group setting. We provide to schools in those settings which give a framework of areas that they need to be addressing to ensure that their children have a good, have an appropriate level of health and wellbeing advice and support. The South Harrow Physical Activity Community Champion, this is a fairly small project, but it has been match funded, and so that's That's worth about £8,000 in total. And again, it's been rather hit by the pandemic, so we're looking to relaunch that. And the Walking for Health schemes, these are walk leaders, we're looking to restart in June, subject to risk assessments being passed. The other new programmes, I'll just very quickly go across. Oral health, obviously a key area in Harrow. We've awarded a new contract to supervise brushing in schools. In terms of mental health, we've been doing some work internally within the council around workplace mental health and promoting the mental health first aid scheme, and we're developing a suicide prevention programme with Brent. The Healthy Start group is about vitamins available for eligible groups. Our eligibility has increased over the course of the pandemic, but our uptake has actually declined, so there's some work to do there. Developing youth mental health support, again, this is the mental health first aid programme, but we're developing that with Thrive and the Young House Foundation. Total schools so far accepted. And the last ones are the parent champion and the youth champion launches. So this is the idea that you can equip some parents or some champions with the key messages so they can pass them on either at the school gate, or if they're children in groups of perhaps 8 children doing a presentation and enabling that possible within the school.
Is that the last slide, Lawrence?
This is my last slide. So this is just where we are now. So we're going to continue doing the surveillance of vaccination testing, IPC, infection prevention control support partners. We're resuming contract performance, as I mentioned just before. There's this increased focus on mental health and inequalities. And as I mentioned before, also, I'm particularly keen to engage schools in that process, carers and our staff. I think there's a whole host of activity that we need to be doing around engagement. This is the outreach work, and I would champion infant mortality as leading the way there. That's a key focus point that we can build up that trust relationship with our communities. And then the fourth quadrant there is about health promotion, MEC, which is making every contact count. So this is every member of staff that we have any responsibility for, ensuring that they know where the appropriate support and information is. And population health management is something that we're obviously developing with the ICP. And this concept is all about identifying people that are particularly at risk of any particular condition. But actually, because they are population health management on clinical notes, we know who they are, and we can work with primary care to ensure they receive that information and advice. And that's the presentation. So I rattled through that. I hope that gives you an idea of where we've come from and where we are now. Thank you.
Excellent, thank you, Lawrence. It does paint a picture of coming through COVID and how we come out the other end. Quite clear. Is there any quick questions? Chris?
Yeah, can I just ask about the annual health check piece in learning disability reviews, where we review the deaths of people with learning disability? The absence of annual health checks is quite a feature. And so as a Safeguarding Adult Board, we're sort of quite keen on keeping track of those numbers. Can you tell me where we are in terms of recovery, catching up those who haven't had an annual health check? Are they being tracked? Are they now being brought into the system? Is it being, it's not being put off till next year, I hope. That's the question.
Chris, can I just point out that NHS Health Checks is not the annual health check. NHS Health Checks is an identification programme for people who don't have any other medical conditions or have any other identifiable conditions. So it's not the same as the annual health checks.
Okay, so right question, wrong person. Sorry about that.
Yeah, I think Genevieve's got a hand up maybe on that one.
I saw Lisa put her hand up, so I thought she might know the actual figure better than me.
Lisa, did you want to answer that question? Then we got Marie as well.
I'm sorry, I don't have the exact figure, but I can provide it after this meeting. I think just the learning disability health checks were never stood down. These were one of the services that we maintained throughout the COVID period, just because of how essential they are. So we are absolutely not expecting the need to recover these, although it remains an absolute priority that we're getting as high coverage as we can. But I will give you those numbers as soon as I'm able to.
Thank you. And Lisa? Oh, sorry, Marie. Sorry, all the way around. Marie.
Hi, it was just to come back on Chris's question about people with a learning disability. Wearing my other hat, which is working for Harrow MenCap, we've just been commissioned by the CCG to do some work to increase awareness of the annual health checks for people with a learning disability to try and improve the numbers. So we're going to be attempting to work with the GPs to try and build up that, because the importance is absolutely imperative, as you've just said. So yeah, if you want any more details, Chris, I can speak to you separately. Thank you.
Yes, thank you, Chair, for letting me ask the right question of the wrong person.
You're welcome. Well, thank you for the report, Lawrence. I think one thing we need to consider is a few years ago you done the report with the young people through Young Harrow Foundation, which highlighted the level of mental health support that was missing, rising demand in there, and it's worth doing a review coming out of COVID to find out exactly where we are again and compare like with like. It was a big piece of work, I know, but I'll speak to Paul later in the week and sort of work out if it'd be useful to do it, because highlighted through all the recovery reports is around mental health and young people, so it might be worth us doing that.
Yes, Graham, I think that that's one of the things that will come out of the
it's called Hey Harrow
report. So last time when we did the first report, we had like 5,000 young people. So far, we've had about 6,000 comply with filling out this latest survey. So it could give us the same information.
Excellent. Thank you very much. So the recommendation is we note the report. Is that agreed? And that moves us on to our final report, which is the Health Watch report, the experience of GP services, a systems update. Marie.
Right, so just to check, can you all see the slides that I've just shared?
Yes, we can see it.
Excellent. I want just to thank you for the opportunity to speak again, because obviously I did share our report with everybody at the last meeting. I was asked just to provide an update on where things are moving to, so I've only got a couple of slides and I'll leave Lisa and Genevieve to come in and dive in at any point if I don't cover things correctly. It was just to recap, our role as a health watch is to be independent and to just gather intelligence of what people say to us. We produced our initial report back in January, which was looking at access to GP surgeries and to dental services, which is what was covered in our last meeting. We also, on a quarterly basis, do quarterly trend analysis reports, which I share with some key stakeholders. I have just realised I haven't been sharing it fully with the Harrow Health and Care Executive, but to certain members. So going forward, I will make sure I do that. And these reports, the bit before we go into the detail about what they've highlighted this time, is really just to point out they only reflect the data that goes in there. So it's only as good as what we hear. We tend to, as with most things, if people are going to provide comments, they tend to be the negative comments and not the good ones. So please bear that in mind with what I'm about to go through with you. Our reports capture the experiences of 561 people. So we put that in perspective with the amount of residents that we know there are in Harrow. The thing I would say is the concerns that we hear do not relate to the quality of the care that people receive. That's normally really positive. The issues tend to relate, as they normally do, to how people access services. But I was asked to speak today because I think it's quite important, and I feel very negative to come in after all the positive work that we've heard to come and give some of the challenges. But I think it is important that this board hears the voice of the residents of Harrow. So a couple of key points that came out of our quarterly trend reports were it The feedback suggests that people were broadly satisfied with customer service, and that's staff attitude and quality. While service access remains an issue for many, complaints are more about the ability to book appointments, waiting times, and the list, and these have all marginally decreased over the last quarter, because we're talking now about Q1 here, which was January through to the end of March. Administration still remains an issue with more complaints reported there, but the overall sentiment is 60% positive and 39% negative. The accessibility on appointment bookings has improved this quarter by 4%. Positive feedback remains low at a figure of 32%. One of the things that our Q4 reports brought out was some concerns around Health Alliance, the primary care network, with there being a particular issue of 92% of feedback being negative with regards to this primary care network. I'm sure you're all aware of this, but just to clarify, the GP surgeries that are part of the Health Alliance PCN, are the Asprey Medical Centre, the Belmont Health Centre, the Stanmore Medical Centre, Stretfield Medical Centre, the Circle Practice and the Enterprise Practice. These GP surgeries of Bacon Lane, the GP Director, Mollison Way, we received some really positive feedback around the work that they're doing. Whilst there are other surgeries where we feel we receive much more negative comments, but they tend to relate back to booking appointments. The ability to obtain timely appointments is a problem for many, with accounts of congested telephone lines and waits for days to see a clinician. Choice is also an issue with some patients not comfortable with or not able to undertake remote appointments. However, the sentiment about bookings and waiting has improved by 11%. So whilst it's still negative, it's improved from where it was previously. And another point just to bring in here is about communication. What the feedback we tend to generally get, and I think a lot of the issues on occasion relate to confusion between different surgeries and how you are meant to access a GP surgery, because I think it differs between surgeries, so people talk to different people. So I think there is something here about the communication and how we make sure each GP practice is really clear about how they want their patients to connect. And the other point that's been fed back to me is that most patients still want to start with a phone call and not with a website. And I think that links back to the communication issue and how we make sure people are clear on how they should access services. And I think that very much comes back to some of the issues and the negative comments that we get. So that's just a quick whiz through there. In terms of the response, so obviously these issues I've shared with both Lisa and Genevieve, and they've both been really positive in addressing some of these issues. Do you want me to go through your response, Lisa, or would you rather go through it? Shall I just keep talking? Yeah.
I'm happy to. Yeah, no, please do. Yeah. Lovely, thank you. So, I mean, this is a really important report, and this feedback is very important for us and for our practices to listen to. I think it would be fair to say that we are probably not hugely surprised that people aren't having a very positive experience of accessing general practice at the moment, because I think general practice has never been under more pressure right now, and absolutely they are recognising the challenges that they are facing, and then of course that their patients are facing too. Some of these issues around telephone access are really important, and the discussions that we're having are around getting that right balance of virtual consultation, face-to-face, and telephone access. I think for some patients over the COVID period, a virtual consultation model has worked really well, but what we're working to is that where patients need a face-to-face appointment, they are getting it. The telephone access, I think, has been problematic, and it's not been helped by the vaccination programme. A lot of primary care staff have been redirected onto vaccination, but there's been a huge amount of patient queries coming through to their own practices about vaccinations, access, things like that. So, and I know a lot of practices reporting to us that their phone lines have just been really jammed with those queries. However, this is really important. With the particular practices and the particular PCNs, we are following up with them to look at what can be done, how this can be responded to, and how we actually measure that we move forward to a more positive place from where we are now. Genevieve, myself, and some of our PCNs and practice staff are meeting with the Harrow Patient Participation Network and yourselves as Health Watch next week. And I'm really looking forward to that conversation, which is, I think, both where we need to listen very closely to patients' experience at the moment. But I think what we're really trying to achieve through that conversation is actually a mutual dialogue of an understanding of the pressures that are being experienced across the system, and actually how we can work together to move those forward, because there probably isn't a magic solution of being able to sort these things out immediately. The pressure will be on general practice, at least in the immediate short term, as a result of the people delaying consulting over the lockdown period, but how we can best work together over these challenging months to make sure people are getting access to general practice services who need to.
Brilliant, thank you, Lisa. So I think Lisa's picked up most of the comments on these slides. I mean, what I would say from a Health Watch perspective, where we've identified particular concerns around GP surgeries, the CCG have been very proactive in talking with those surgeries, highlighting the issues, and actually putting plans of action in place, particularly with the surgeries that you can see on the slide here. The only other thing I was just going to move to finalise is, in addition, we produced a report a short while ago around the Harrow mental wellbeing of people. And we did sorry, I'm rambling a bit here. We did a survey, and we culminated the findings of that survey, which we then produced into a report which we shared. There were no surprises in there, what you'd say. I mean, I think from all the things that have come out in all the various presentations today, the impact of COVID on the mental health of people is massive. So it didn't show us anything that we did there, but I thought it was worth me briefly showing the conclusions that the report came to and the response that we've then had from CNWL on how things will move forward. So the key bits that came out of it were, and this is now regarding mental health, not GP, it's about accessing out-of-hours services was cited an issue, along with the consequences of digital exclusion. Stress, worry and anxiety are cited as key areas of concern as a result of the isolation, demanding workloads, risk of infection, poverty and job security, just to name the more obvious ones there. The easing of restrictions, obviously we all know, will help improve life for individuals. It will help reduce that loneliness and the isolation. The longer term impact places a greater reliance on the support services being available, but also people being aware of where they can get that support. This relates to the local community support through the community teams, GPs, the voluntary sector, and through CNWL themselves. But what it's highlighted for us is there is a need for a greater communication of the support that is actually available, how you access it, and that the future commissioning of the services needs to meet the increased demand, because the increased demand is clear. It's just making sure that the services to meet that need are there. The quote I did like was from a member that completed our survey, was an appreciation that it is not just the formal mental health services that contribute to a person's mental health. It is also the clubs like the bowling clubs which contribute hugely to people having a positive outlook on life. Our report was shared with CNWL, and just to finish off in timing, if we've got enough time, Graham, is just the response that we received from CNWL is in terms of the steps that they have been taking, which is all community adult hubs are offering patient choices for face-to-face appointments, to telephone consultations and telemedicine. We have set a target for our face-to-face contacts to go up gradually, which is good to hear. Forgive me if I pronounce any of this incorrectly, I'm not medically minded. The psychotropic medication and physical health clinic for depot and clozapine has remained open through the pandemic, and patients attend Bentley House as per usual, and where necessary they facilitate home visits and are carrying on with physical health checks. They have invested through the BCSE project and currently are providing social inclusion groups 2 days a week on a Wednesday and a Sunday, and Ignite due to also offer services in the coming weeks. They have also have an option of referring their patients to the coast for extra support during the crisis. There are 3 social prescribers in the adult hubs, and going forward they expect the relationship to strengthen with the primary care. There's additional funding there for new posts, which is great to see, and it sees that there are group therapies are more formalised now across a number of mental health conditions, and they follow the trauma-informed approach. So that was the response I received from CNWL. Whether that meets the demand, I'm afraid I'm not knowledgeable enough to know, but it certainly sounds like steps have been taken in the right direction. Apologies if I've rambled a bit there. I hope that makes sense, and thank you for providing us the opportunity to raise these issues with the board. I appreciate that.
Thank you, Marie. Thank you. Welcome. Genevieve, you had your hand up to this.
Thank you. Yes. So thanks, Maria, for bringing this report to the board. As Lisa said, really important. And as Lisa said, we will be meeting with yourselves and the HPPN next week to talk about some of the issues that you've raised and some of the issues that actually primary care is juggling at the moment. And I think that it's probably worth us reminding ourselves that nationally, and I think this is absolutely borne out locally, actually primary care is doing 10% more consultations this March than last March. And that figure has only gone up since March, and we're waiting for the latest data to come out that will be taken in June to see where we are at. I have to say I've never known general practice as busy as it is now, and I think it's a perfect storm of many different aspects, and for some people being able to contact us online works really well, and that gives them an accessibility to primary care perhaps that they weren't getting before, whereas other people are struggling with some of the access into primary care, and some of that is actually borne out just from just the number of phone lines that actually come into certain surgeries. There's a physical nature of how quickly can you deal with calls, and I think it's desperately important that people access primary care and we pick up on all those services that perhaps they hadn't wanted to bother us about during the COVID period, because it is incredibly important. But I would also be grateful if just in general we could be kind to our primary care teams, because as the report said today, there is a wide degree of exhaustion across health services, and that does include primary care as well. So I'm sure together we can get to a good place, and I do feel really sorry if patients have struggled with access to any of our GP surgeries, but hopefully we can work together to make people feel that we are more accessible.
No, and I appreciate everything you're saying there, Genevieve. I think from our perspective, it's how we can help with that communication as well, and how we can work together. No, thank you.
Thank you. And we have one other hand up, Maxine.
Yeah, I just wanted to has been issues with getting appointments with GPs, but I know in my surgery they have been telling people when one hand people have got appointments, they have to go to Northwick Park, but they have managed to see a doctor.
Okay, that's good to hear.
Yeah, I had to do it because I get an appointment, and so they signposted me there and I managed to see somebody, but yeah, it's really difficult for them.
Thank you, Maxine. And the final question comes from Krishna.
Thanks, leader. It's about the negative comments from most of the GPs services. It's a bit boring actually, because my question is, how are we going to prioritize the negative comments to rectify the issues? And also we would like to share, if you could share the comments that you received also, that would be good. Thank you.
Yeah, more than happy to share our portable trend reports with you. That's no problem. I can share them through the board and share them with everybody. That's absolutely fine. But as we said at the start, they're only reflective of the people that come back to us. And yes, I appreciate you might think it's boring, but I think it's still, if people have taken the effort to feed their comments back, I think it's only right that we give them the opportunity to be heard.
Thank you. As we saw from Lawrence's report earlier, that there was quite a challenge within the community groups as we went into COVID. And this has borne out, with people from Black heritage community not going to GPs or accessing GPs straight away. And, there's something that was resolved and moving forward. So there is, as we erroneously call them, hard to reach groups, in the sense that we need to work out how we can sort of encourage those groups. It will be coming through as a priority from the ICS, and we spoke about right at the beginning, so it's a full circle, this meeting. We've got services under pressure, but we've also got to understand how we can reach out to those who may have some form of challenge or difficulty in accessing some of the services that are available, and how we make that easier, understanding that services are still under a lot of pressure. Mohammed, you wanted to come in on this final point?
Yes, it's just I was just reflecting on the report, to be honest. In one way, it's very positive, because only 561 people felt they didn't have their needs met, whereas the rest of Harrow was probably 200,000 people, is still okay. So my thinking is that there's a lot of patient education needed, and I think Health Watch and HPPN are in a very privileged position to help both sides, because the GPs under pressure, plus also with a lot of stuff going online. I think it would be a very good thing to see how are the deprived groups, looking at them, because there's so many patients in my practice who can't read and write their own language. Far from, being online, they've never used a computer, they don't have smartphones. So from that element, I've always been, an advocate that we should hear their voice as well, because we're creating a system for people who are going to be there after 25 years, but we've forgotten the people who are here now. So this is what I think is a bit of an inequalities position, really, that we need to look into. But overall, I really look at the report in a positive sense, that the majority are happy rather than the majority being unhappy at the moment. Thank you.
Yes, it is a positive report. Marie, would you like the final word on the report?
Yeah, I was just going to say, I appreciate your comments there. I don't think we can assume the rest are happy. I think it's more the fact that they've not completed and told us, but I like your positivity. I think that's great. And I think, we are more than happy to support and help where we can. I think education is one of the big issues. I think people complain when they don't know. We are more than happy. We did some lovely work with the Ridgeway surgery last year when there was an issue with the Romanian community, and we worked with them to produce some bilingual communication. Again, more than happy. Just remember, we are a tiny team with very little funding, but within our ability, we are more than happy to help and support wherever we can. Thank you.
Thanks. You do a grand job. So the recommendation is that we note the report. Is that agreed? Excellent. And I haven't been notified of any other business, but I would suggest one point. The only report that we might have is for the Better Care Fund in July. We don't have to bring it to the Health and Wellbeing Board, and then we can have the better discussion in September. So we're minded really to remove the Health and Wellbeing Board meeting scheduled in July and have the one in September. They are very close together. We set them out early in the year, and unless people particularly want to have a meeting for one item, I think it might be worth postponing it and just having the meeting in September. Is that agreed? Everyone's nodding assent.
Agreed.
So we cancel the July meeting. We deal with the Better Care Fund reports and send them off, and we'll report back in September about that part. So thank you very much for your time today. I apologise for running over, but I think it's really key reports are coming through and have shown what has happened in Harrow very clearly throughout the pandemic and going forward, but also set out a lot of the challenges that we face going forward. But I think now collectively we can get through it all. So thank you very much. Well done. See you all soon. Thank you.
Thank you.